On 12th of September and in Glasgow on 5th of September, health workers will be on the streets again demanding a pay rise. The movement started with a London demonstration on 29th of July, spread through protests across the country on 8th of August and workplace rallies on the 26th of August, and is continuing through Wear a Badge days every Wednesday. The driving force here are nurses. They have suffered dangers and stress in the pandemic, and before that, years of NHS cuts and pay freezes. Even before the pandemic, for years, campaigners have warned that hospitals routinely run at 95% capacity in the winter, and just a worse than usual flu season could overwhelm them. Nurses are not the lowest paid health workers, but their pay is slow for their qualifications and conditions. The French government has awarded pay rises, inadequate but rises, to all hospital workers following the lockdown. Winning on pay can unlock other issues. Isolation pay for all workers in the NHS, including casual and contracted out, in-housing of jobs, better nurse to patient ratios. The protest leaders have explained that they need to budge the health workers' unions, Unite, and G&B officials have given some support, but largely passive. And Unite and G&B have relatively little weight here, especially among nurses. The RCN has demanded a 12.5% rise, but it is a conservative professional union, which struck for the first time in its history as recently as December 2019 in Northern Ireland. Unison is the biggest union in the sector, but has submitted a pay claim on the 28th of August for only £2,000, more like 5% than 15% for an experienced nurse. And it's not campaigning. The current General Secretary election in Unison gives leverage to shift that. The left-wing candidates, Paul Holmes and Hugo Pierre, currently do not mention NHS pay in their platforms, instead stressing local government issues. But they are known to back the protests. If they make a storm on NHS pay, they can apply pressure to the other candidates, and so too the union official top ranks, which those candidates are already inserted. The Labour Party, and in the first place left Labour MPs, should also make a storm about NHS pay. Other workers should consider our own pay claims, whether we can time industrial action on wages to coincide with NHS pay strikes or protests, thus giving effective solidarity to health workers who may have difficulty staging strikes if hospitals become stretched in a virus resurgence.